This presentation today is about our Global Healthcare Management with Roots. It's one of our most popular programs at the Global Business School for Health, and it's an ideal program for anyone interested in health and healthcare and who wants to really hone their management skills. So first of all, before I talk to you about the program, I want to talk to you a little bit about the Global Business School for Health. We're the first business school in the world totally dedicated to educating the next generation of health and healthcare management leaders. And that's really important to us because the health sector is growing at an exponential rate, not just in a certain country, but worldwide. We see that aging populations, also coupled with climate change and lifestyle changes, has meant that healthcare is more important today than it's ever been before. And we're very excited to have this program that really focuses on the needs of the sector. When we went out to develop this program, we did extensive surveys with employers, and we asked them what did they see as the areas that they wanted to have employees of the future in. And the three areas they identified, of course, was leadership, having courageous leaders, people who could lead their organizations, who could really think across boundaries and reimagine healthcare. They also mentioned finance, because of course aligning your strategy with your finances and being able to manage healthcare finances is quite complex. Healthcare in general, by the way, is a very complex industry. It's, we talk about healthcare as a complex adaptive system. Health systems vary between countries and the way in which they finance. So finance is really at the heart of much of the differences between various healthcare systems in the world. And then thirdly, of course, is analytics. More and more of what we do is driven by data. And so understanding not just the kind of technical side, but how do you take those analytics into making good, quantitative, evidence-based decision makings as a leader and manager in healthcare. So these are really three aspects of our roots and of our school, moreover. When we think about how we break down into research areas, again, what comes out loud and clear is finance and operations. And we've got a whole research theme and group around that. We've got another one around, kind of health management and innovation. And then thirdly, we have a research group around health systems. And people across all three of these research groups make up the faculty on our Global Healthcare Management program. So you're going to get lots of exposure to different academics coming from different angles and different viewpoints who are going to teach you on this program and help you understand and pull it all together into thinking about how do you manage and lead in healthcare. So we are then, most importantly, an interdisciplinary department. And that's because also, if we're going to address the challenges of health and healthcare today, we have to do it not thinking about our disciplinary silos, but thinking much more about how the health system comes together and the questions that we need to ask. And so, many of you will have done bachelor's degrees, or all of you, in kind of very narrow disciplines. And this will be an opportunity actually to get breadth and depth of your understanding of the health and healthcare management landscape. So really exciting program. I'm really proud to be the director and at the Global Business School for Health and be involved in this. I teach, by the way, the strategic leadership course, which is my passion, which brings strategy and leadership together. I'll talk some more about that in a minute. So just overall, this program then is really about understanding this kind of contemporary healthcare landscape, getting comfortable with blurring disciplines and boundaries, and then understanding how they all come together in this complex adaptive system that we call health systems. And to get that health systems thinking. So we spend quite a bit of time across our modules pulling together this kind of thinking around health systems and then moreover systems leadership. So it's that global lens too that makes a difference. All our faculty, by the way, are from different health systems, different countries. We're very multidisciplinary, but also interculturally. We're from lots of different health systems. So you get to not just understand the NHS, you get to understand the US health system, the Chinese health system, the Indian health system, examples from other European countries, Africa, because that's what healthcare in our contemporary landscape is, to one or equivalent, depending on where you're coming from. And that's the requirement in terms of your IELTS. You need to have a 6.5 overall, and no less than a 6 in any individual area. Then you'll have to put together a personal statement, and those personal statements are read. They're really important to the decision-making that we make around particularly people who are pivoting into healthcare management. And then, of course, a reference. And ideally, that should come from one of your an academic reference. If you've been out of the academy for a while, of course, an employer reference will do as well. So who is this program for? Well, this program is for people who are really looking for career advancement. The program is not designed necessarily to be a research degree program that would lead on, say, immediately to, say, a PhD. This is really a professional program to give you advanced learning at a graduate level to help you take jobs and move into jobs and careers in the healthcare space. So ideally, we're looking for individuals who want to excel as managers, change makers in a healthcare setting. You can be a new or recent graduate from health or science or a business field. That really sits with our ethos of being interdisciplinary. And then you may also want to reflect on your work experience. We have a number of people who come from clinical backgrounds as well. People from dentistry, so it's really about bringing lots of different professionals together to think about healthcare and management and leadership. So in terms of how the program is structured, you'll come, in kind of late September. You'll have a 1-week induction, which enables students to really focus on their professional development and journey. You'll also have an opportunity to complete a course in global health. We've also got other primers that you can take, one in accounting, finance, health economics. All of these are to help level the playing field so that everyone is comfortable when they come into the course. In the first term, and the way we have structured this, because we don't want you just to be in that kind of specialism. We want you to be able to also talk across to the others on your global healthcare management program in other specialism. So the way it's structured is in term 1 and term 2, you'll take 2 of the core modules. So you'll take leadership and management for healthcare. You'll also have a health economics course. And those will be taken across all the routes. And then you'll have 2 courses that are specialized to your route. So depending if you're on the leadership route, the finance route, or the analytics route. And then you'll also, so in term 3, you can see that you've got a business project, which is a great opportunity to really innovate. You'll be able to work in a team, again, very interdisciplinary with people from different parts of the program, to develop an idea for a healthcare improvement. And you'll come up with a concept to creating a business plan and making a pitch. And that's really important to help you see how to create and have an entrepreneurial mindset. And the research project, you can pick a topic and of your own. We don't expect you to do primary research. So we say desk-based research. What we mean is really secondary research. So it can be, using data, coming up with a solution, depending on what you and your supervisor agree. But it can vary in terms of how you approach that. So the reason I'm bringing the term 3 projects in is because in term 1, you'll start to have a series of workshops so you can learn more about the business project. And in term 2, you'll have a series of workshops to learn more about the research project. So by the time you get to term 3, you're really ready to go. So, and then in term 2, again, you've got 2 core modules and 2 elective modules. Now, a lot of times what comes up is funding. We do have a few limited scholarships for MSc students within the department, and we try to give as many as we can. So we've got the Women Healthcare Leaders Scholarship, which is up to $5,000, and we've got the Global Healthcare Leaders Scholarship, which is also up to $5,000. And as international students, you can definitely apply to those. And we give a number of those scholarships to students in the department. There are also a scholarship finder at UCL, and you might go to that and look for scholarships. Of course, there's loans that you can get. So if you're from the United States, you can get a federal loan. If you're in the UK, of course, there's other loans that you can get. And there's also other scholarships. So we have a number of students who have had Chevening scholarships, Commonwealth scholarships. So again, I really highly encourage you to consult your British Council to see what scholarships maybe from your health ministry that might be available. We have a number of students who come on scholarships through their own health ministry or government. So, and we're here to support you. If you have any questions or comments or want to know more about opportunities, we're happy to engage you around that. The other thing is, as I said, these are really professional programs. They're about helping you, to move to the workforce in a successful way and to add to the cadre of individuals across different careers in this space. One of the things in terms of our pedagogy is we use what's called a flipped classroom. So you've got quite a bit of content, videos, exercises, discussion forums, readings that you do before you come to class. Your classes will be a mix of seminars and lectures, but we put a real emphasis and premium on giving you as much real-world experience as we can. So we use case studies. We also use simulations. So for example, in my strategic healthcare leadership course, I use a simulation called Healthcare Leaders. Students come up with a strategy. They run a hospital. It's all, it's online. It's a simulation, but they learn what it's like to align their priorities and their finances with their strategy. And it's a great experience. Students love the game, but moreover, they learn just the importance of how to take their strategy and actually implement it in terms of how they run a hospital. So it's a very good example and really helps them be job ready when they finish. And it makes for great conversations and interviews. So that's just one example. There are other simulations used by colleagues, other case studies. Role playing is something that we do, point, counterpoint, where you have the opportunity to kind of argue your position on a topic. So really engaging you, helping you to not just think theoretically and systematically about health and healthcare, but actually to apply it. And that's because we are very interested in your career outcomes and providing you with that career support. So, from week 1, we start to really help you on your career journey, try to support you to get a job, get your CV in place. We run career festivals within our department, in addition to all that's done at UCL Career Services. We also encourage students to think about incubators and places where they could have startups. Last year, we ran a Dragon's Den, and we had some students who are actually from India who won that competition. They went on then to get a place, a 2-year space here in London at the Hatchery, which is part of UCL's innovation on entrepreneurship services. And we had another student as well. And so these are all part and parcel of helping you think more widely about your future and your career, and making sure that your ambition is met across the program. So what are some of the areas that our students are interested in and go out and get jobs in? Well, of course, health consultancy, and that's not just these big 4 consultancy firms, PwC, Deloitte, KPMG, and EI, but McKinsey, Boston Consulting Groups, and of course, there are numerous smaller consultancy groups, which I always encourage students to think about, because it really helps develop your skill set to have opportunities in multiple areas. There's also management roles in pharma companies and biotech, and of course, public and private healthcare, hospitals, insurance companies. So there's a wide range. Of course, all of these organizations need healthcare management and leadership. And then last but not least, as I just mentioned to you, health tech and med tech startup market. So this is all part and parcel of really thinking about where your strengths are, your previous experiences, how you can take that forward in a meaningful way. And we're here to really support you, as I said, not at the end of your program, but throughout your program, so that you get the career and the job that you're looking for. Then, in addition to the academics and your learning and your interactions with your classmates, UCL is just a fantastic place to be a student. We have all sorts of extracurricular activities and student support. We have a wonderful student union, numerous clubs and societies. We've got around 70 sports clubs, and they're great places to meet people across the university, across different programs, get student support and well-being team, which is fantastic. It's all about really helping you be your very best. And that really is what it's all about. We want to ensure that you have a fantastic experience with us. You're going to be our alumni. And so we are very invested in your career, your future, as well as your student experience here at UCL. And then, we are in a brand new campus. So we are part of a build called UCL East. Of course, it's all one UCL, and that's really important to realize. But this part of London where we're on the Queen Elizabeth Olympic Park. So if you see that picture, the building with a little bit of red in it is our Poole Street facility, which has student accommodations. And then we've got our Marshgate facility, which of course is also a great facility. And, we really have wonderful space for you, great study space, meeting space. This just, not to mention the environment. It's a beautiful facility. There's also the aquatic center. So if you like to swim, or there's a gym in there as well. So great for sports facilities. Shopping, we're just literally 8 minutes from one of the largest, if not the largest, shopping mall in Europe. So you'll feel at home. There's lots to do. This kind of part of East London is called the cultural quarters, and so there is a Victoria and Albert Museum that's going to be opening up. There's a theater, and there's other universities. So lots of students to interact with, and a great just general student life. And then of course, London itself is a fantastic city. It's a great place to visit, but it's a more impressive place to live. It's well connected through transport, lots of museums and galleries and institutes that are free, beautiful parks. So it is a wonderful place, and no wonder ranked the top city for students in the UK. So that's the end of my presentation. As you can see, we've got other programs and dates for those open events as well. I'm now going to stop sharing my slides and look to answer any questions you have. I hope you found that presentation useful, and I really look forward to interacting with you. So please put your questions in the chat, and I will take them. Okay, so the first question I've got here is, do consulting companies run open days to help recruit from the program? We do have at UCL. So they come actually to the university through the UCL Career Services, but we do also invite consultancies. When we had our career festival the other day, Deloitte's helped sponsor that, and we had a speaker from Deloitte. So there are definite opportunities to learn more about consulting. We are very keen to ensure that our students and their applications are front and center. I'm interested in this degree and also the digital health one. If I am accepted to one program, is there an opportunity to attend classes from others, even to audit for an additional fee? We don't actually do that, but I'm sure if you wanted to audit a class, we could probably arrange that. Hasn't been something that a student has requested at this point. I do want you to know, though, that we're constantly running events. So there's lots of opportunities to learn about digital health and also to learn about healthcare management as you go through the program. That's something that we're very keen on doing. We have webinars, we have live events, we have speakers coming in all the time. So, I'm sure there'll be multiple opportunities. And again, I think what I would do if I was you is I think very much about what your career ambition is, what are the kind of skills and competencies that you'll gain from each program. And then I think, select that program, and then there's going to be other ways that you can interact across the school. We're really focused on building a community. And that community is about learning. So there'll be multiple opportunities for you to learn and develop through these programs. In fact, actually, one of the programs on the leadership stream, which is innovation, leading innovation and change management, has a lot on digital health in it. Okay, what is the workload like on this course? Is there time to pursue other interests, and would it be packed? So you're going to be busy. It is a master's degree, and if you're full-time masters, you're going to have to manage your time. But we have students who seem to manage quite well. I always believe that busy people tend to get the most done. And we have a number of students who work part-time as well as do the program. So I think it's manageable. It's 1 year. It's going to go so quickly. So you really want to pack out and do as much as you can and really make the most of your experience here in London. How does this course differ from the UCL MBA Health? They differ actually quite a bit. The programs are very distinctive. An MBA is for someone with career experience and who is interested in, taking their career or what they're already doing to a kind of a new level. It has a complete different mode of delivery. It's delivered in blocks. Again, it uses a flipped classroom, the case studies, but there's an opportunity in the MBA to travel abroad through the Global Health Challenge. It's targeted towards a different demographic. And so whereas in the global healthcare management, you're going to learn a lot more about healthcare management, and depending on what route, you'll get a real grounding in that. It's much more subject matter specific, whereas an MBA is much more general management that you'll get in terms of content. So it's delivery, it's also content. Would this course be useful for someone who wants to progress into the care home sector, running care homes and financials behind them? Yes, I think this would be an ideal program for that. Very much so, actually. And then I think it would be just deciding which route would be most appropriate for you, whether it be the leadership route or it'd be the finance route. Again, I would suggest, when you mention financials behind them, if you're thinking about more from an investment standpoint, you might want to do the financial route. If you're thinking from actually running a care home, I would probably do the leadership route. Okay, I now don't see any other questions. I'm going to just wait a minute and see if you have any other questions. Oh, here we go. Will this course help those who are interested in public health? Absolutely. I think one of the things that we've come to realize is that separation between private and public, it doesn't work anymore. We need partnerships. And so even in the public sector now, and public health is very much focused on public-private partnerships. So I think what is ideal about this program is you get both of those parts of the equation. And I think you would be extremely valuable in a public health setting. Next question. I majored in German, but very interested in health. In fact, as a research analyst, one of my research areas is healthcare. Will having relevant work experience or taking online courses be helpful, such as Coursera, help my application? Absolutely. I think that's where the personal statement comes into play. We're, one of the reasons we are very open to different disciplines is A, because we ourselves are interdisciplinary, and B, we realize that the health sector needs lots of people pivoting into it to meet the workforce demands. So we're very open to different kinds of backgrounds. What we look for, though, is really in the in your application, in your personal statement in particular, we look to see that you understand that you've kind of thought through this next step in your career. And so bringing in your work experience into that personal statement is also very helpful, as well as, making sure you have a good reference who also can reference why someone who had majored in German is now very interested in health. And, my own personal journey, I always describe it as kind of two chapters. I started out very interested in economic development, focused on the Middle East, and then mid-career went back, got another master's in health economics and pharmacoeconomics, and then pivoted my career much more over into healthcare management. So I can assure you that I'm very valued in my current role and in my work and my research, and having that kind of wider cognitive skills and that ability to bring different areas of expertise into my thinking and research. So I think you would probably be very valued in that same respect. Okay, is there any other questions? All right. And I can see that Selena has put into the chat, you can book a virtual one-on-one with me to discuss your individual situation and address any queries you might have. So just email our contact GBSH and we'll get this sorted. And someone's asked, is this a one-of-a-kind course to London universities? Yes, it is. I think what makes us really unique is that we are the only business school in the world, actually, that is totally dedicated to health and healthcare. So we'll teach you lots of the things that you'll be taught in another business school, but we'll do it all in the context of healthcare. All our case studies are healthcare. All of our academics are, interdisciplinary academics who can bring that healthcare lens to the questions that you have. So we are very distinctive and very unique in that respect. What is the average age of this program? I would say probably around 25, 26 is the average age of people on this program. Again, it depends. which route you pick as well, but I would say that's a pretty good approximation. We do have some students who come straight out of undergraduate degrees, as well as people who've been out in the workforce for many years and decided to come back either to pivot into healthcare or because they want those managerial skills to take themselves to the next level. Okay, so I think that's all of the questions. Look, it's really a pleasure to have this opportunity with you. We do have a YouTube channel, and we've got lots of videos there, as Selena has mentioned. So you can always go there and visit those. But again, we're here to support you. This is a big decision. It's a big investment. And so we want to make sure that you get it right and that we're able to help you with whatever you decide to do. So thank you so much for your time. And I look forward to getting to meet you at some point in the future. Take care. Bye-bye.